Assalamualaikum warahmatullahi wabarakatuh. Welcome back to my YouTube channel, Aiman Story. Here is me, Aiman. Okay, thank you for my subscribers for following me on my YouTube channel. Okay, as I promised in the previous video, today I will continue my educational series on COVID-19. But for the previous video, I already talked about the infection of the cell caused by SARS-CoV-2 virus or COVID-19 virus. So today I'm going to tell a little bit about the post-infection of the COVID-19 virus or SARS-CoV-2 virus. So based on the explanation of the previous video, so the alveoli, once the cell, the type 2 cell, okay, the type 2 cell was infected by the SARS-CoV-2 virus, okay, the virus will be exported out from the cells, and then the cell itself undergo the process of transmitting or secreting the inflammatory cytokines, okay, named as interferon alpha and also beta. Okay, what's the function of both interferons alpha and beta? Actually, it will stimulate the function of other cells, nearby cells in the vicinity, to activate the formation of anti-peptide particles. Okay, anti-peptide particles. So what's the function of anti-peptide particles? It will attack to the certain virus that was experienced by the previous cells. Okay, it will give the signal to other cells, nearby cells in the vicinity, to attack the virus particle. Okay, other than that, the cells, okay, the cell also give the instruction of the inflammatory signals to the other cells. Let's say in this video I will focus on the macrophage. Okay, the macrophage is the big cell in the human cell. Okay, it is important cell in the immunology. Okay, well, in the first place, okay, once the cell, the disease cell, okay, once the virus came out from the type 2 cell, and then the type 2 cell will give the signal to the surrounding, to the nearby cells in the vicinity of the microenvironment inside the alveoli. It will give the signal to the macrophage. Okay, the macrophage itself will secrete, okay, will secrete the inflammatory cytokines. Okay, cytokines. So what's the cytokines that are involved from the secretion of the macrophage? Okay, one is interleukin 1, interleukin 2, interleukin 6, and then interleukin 8, and another one is tumor necrotic factor alpha. Okay, those cytokines, okay, will transport out from the inner compartment of the alveoli. It will pass through the interstitial space, okay, and then they will go to the blood capillaries. So when they go to the blood capillaries, it will they will move through the bloodstream, and then it will give the signals to other cells. Okay, it will give the signal to the other cells, the inflammatory cells, to take action on the foreign virus. Okay, so in this video I will focus on what's the next step once the once the inflammatory cytokines interleukin 1, 6, 8 and thermonuclear factor alpha will go to the bloodstream, and then the inflammatory or immunology cells like neutrophil, okay, neutrophil, it will go to the bloodstream. Okay, it will go to the bloodstream, and then it will pass through the interstitial space, and then it will reach to the alveoli. Okay, it will reach to the alveoli. Once it comes to the inner space of the alveoli. Okay, it will release the ROS and also the protease. Okay, ROS and also protease. So what's the meaning of ROS? ROS is an abbreviation of reactive oxygen species. Okay, it's like a free radicals group. And then another one is protease, is the catalytic enzyme to cleave the protein structure or lipid bilayer of the cell. Okay, the ROS group, reactive oxygen species, and also protease will harm the type 2 and also type 1. Okay, type 2 and type 1. So what's the effect of the attack on type 1 and type 2? So type 1, okay, type 1 is involved in the gas exchange. Okay, type 2 is for surfactant production. Okay, surfactant production. So once both cells, type 1 and type 2 cells, are destroyed or harmed by this attack from the neutrophils, okay, the ROS and also the protease, okay, the function of both cells are deactivated. Okay, so what's the implication of this condition? It will lead to the hypoxemia. Okay, hypoxemia, and then it will lead to the following symptoms like shortness of breath. Okay, shortness of breath because of the lower partial pressure of oxygen. It is because by once the virus attack the type 1 and type 2 cells, okay, when the cells are destroyed, okay, then the immunology mechanism also, even though they attack, okay, the virus, but at a certain extent it will go wrongly to attack other nearby to attack their own cells, the healthy cells, and then as a result it will give the destruction of the healthy cells, like for example type 1 and type 2 cell. Okay, so as a result, the condition of the microenvironment in the alveoli, it will make the condition like this. So once the alveoli is attacked by the virus, okay, the condition of the both type 1 and type 2 cell also destroy. Okay, the pressure of the alveoli will be compressed. Okay, so this alveoli will be collapsed because of the function of the type 2 inner cells also deactivated. So there is no surfactant production, and also the type 1 also destroy. So the result is the uh, the process of gas exchange also cannot occur. So it will give the productive result of this alveoli cannot be site of gas exchange, and also it will lead to the hypoxemia. Okay, hypoxemia, and then shortness of breath. Okay, so condition is like this. If in the alveoli, once the attack of the virus, okay, the oxygen level will be decreased, and then carbon dioxide will be increased. Okay, so this is against the normal situation of the healthy lung cells. Okay, so in this COVID-19 infection, the oxygen level will be decreased, will be dropped, and then the carbon dioxide level will be increased. So because of the function of gas exchange is not is impaired and is not functioning, so the carbon dioxide cannot be out, cannot be exported out, and also the oxygen cannot be transported to the cell and human tissues. So we can see the result of this condition. The carbon dioxide will be too much in the bloodstream. Okay, and then it makes the condition of the blood become acidic. Okay, become acidic because of the process of this carbon dioxide will be degraded. Okay, and then it will make the H plus ion will be increased in the blood. So this situation is called as hypercarbia. Okay, and then this hypercarbia will lead to the condition of respiratory acidosis. Okay, acidosis. Okay, so it will become acidic as a result of the impairment of the alveoli. Okay, so other than that, we can see that the inflammatory cytokines interleukin 1, interleukin 6, interleukin 8, okay, will undergo the activation of coagulant, okay, so it will decrease the formation of anticoagulant. Okay, so as a result, once these inflammatory cytokines influence the formation of procoagulants in the bloodstream, so as a result, there will be too many clot formation. Okay, clot formation in the bloodstream, in the blood vessel. So as a result, the condition that experienced by the COVID-19 patients something like this in the following symptom, like pulmonary embolism. Okay, embolism. So there will be high chance of getting a blood clot in the blood vessels. Okay, for those COVID-19 patients that have experienced a serious or severe condition of COVID-19 complication that I will tell you later in cytokine storm. Okay, cytokine storm. So the cytokine storm is the condition when the inflammatory cytokines are attacking their own healthy cells rather than the virus itself. So as a result, they will give the implication of the systemic inflammatory response syndrome, SRRS. Okay, and also for the alveoli itself, okay, it will lead to the acute, acute respiratory distress syndrome, ARDS, ARDS, and ARDS, acute respiratory distress syndrome. So other than that, we can see that for the following symptoms for those COVID-19 patients, besides fever, besides coughing, and then shortness of breath, hypoxemia, and then respiratory acidosis, you can also see the function of those destroyed type 1 and type 2 cells will produce leukotrienes, leukotrienes that will influence the vagus nerve, at the cranial, in the central nervous system, to give the cough reflex, and other than that, this leukotriene, will give effect to the bronchial smooth muscle, so it will make the bronchoconstriction of the bronchial that attached to the alveoli, so it will constrict this bronchial as a result of the activation of leukotrienes to this area, the smooth muscle. So other than that, the function of the interleukin 1, interleukin 6, and also the TNF alpha, those inflammatory cytokine also give effect to the central nervous system, through the bloodstream. They will migrate to the bloodstream, and then it will pass through the blood-brain barrier and then go to the hypothalamus in the central nervous system to signal the production of the PGE2, prostaglandin E2. So this prostaglandin is important as a body thermostat. So once those inflammatory cytokines influence the production of high prostaglandin E2, high prostaglandin E2, it will result the condition of high temperature of the body, so it will lead to fever. Other than that, we can see the condition of this viral infection, in the alveoli, all those cells have the presence of ACE2 receptor, ACE2 receptor, angiotensin converting enzyme type 2, This receptor also present other parts of the human body, especially in human organs like kidney, liver, lung, heart. So for the cytokine storm, it will give effect to those affected human organs like kidney. It will lead to the reduce the kidney renal function, and then for the liver also, it will give the high level of liver enzymes, and then for the heart also, it will reduce cardiac function, and then it will give result to condition like cardiomyopathy. So that's a brief explanation of the effect that can be experienced by COVID-19 patients as a result of the deterioration of function of inflammatory cytokines, okay, in the human body, especially that are experienced by the COVID-19 patients. So the effect of cytokine storm, okay, cytokine storm are a real a cause of the death of COVID-19 patients at the end of the course of this infection. Okay, okay, that's all from me. Thank you for your listening. So I hope you will enjoy my brief explanation about this COVID-19 educational series. Okay, hopefully I will explain later in the next video on the next topics related to COVID-19 and also other science topics. Okay, please like, share, and subscribe. Okay, thank you.